Effects of drug abuse on teens. Drug misuse can have detrimental impacts on one's health at any age, but youths who abuse drugs are more vulnerable to harmful effects. Teens who take drugs are more prone to develop addiction issues later in life and suffer lasting, irreparable brain damage. Other typical side effects of juvenile drug use include 1. Emotional issues. Drug misuse can contribute to or hide emotional issues like anxiety, depression, mood swings, suicidal thoughts, and schizophrenia. In fact, 34.6% of adolescents with serious depression admit to using drugs. Unfortunately, drug use can make these emotional issues worse. Teenagers who use marijuana weekly, for instance, have twice as much of a chance of developing sadness and anxiety. 2. Behavioral problems. Drug-abusing teenagers are more likely to experience social issues, sadness, suicide thoughts, and violent behavior. A recent survey conducted by the Substance Abuse and Mental Health Services Administration found that drug-abusing youth are more prone than non-abusing teens to participate in criminal activities including fighting and stealing. 3. Dependence and addiction. According to studies, a person is more likely to have a substance abuse issue and relapse in later life the younger they are when they start taking drugs. 4. Risky sex. Drug-using youths are 5 times more likely to engage in sexual activity than drug-free teens. Drug-using teenagers are also more likely to engage in unprotected intercourse and have sex with an unfamiliar person. Due to this, there is an increased chance of teen pregnancy, sexual assault, and STDs. 5. Issues with learning. Drug misuse affects both short and long-term memory, which can cause issues with learning and remembering later in life. 6. Diseases. Teens who use needles to abuse drugs run the risk of contracting blood-borne illnesses like HIV, AIDS, and hepatitis B and C. 7. Brain injury. Teenage drug usage can cause severe mental illnesses or irreversible, permanent harm to the brain or neurological system. Teens who consume drugs are more likely to experience brain shrinkage, diminished learning capacity, amnesia and memory issues, poor thinking, perception, and intuition, altered socializing, and changes in sexual desire. 8. Car accidents. Teenagers who take drugs are more likely to sustain injuries or pass away in auto accidents. According to one study, between 4 and 14% of drivers who are hurt or killed in collisions test positive for THC. Thank you for watching. Kindly don't forget to subscribe and hit the notification bell for more updates.